program marking the dedication of the Eye Center at Jackson Fairdo Memorial Regional Referral Hospital, March 19, 2022, at the precise hour of now. This welcome remarked, and that will be done by Vivian M. Kalua.
The Jackson FDO staff, ladies and gentlemen, we are pleased to welcome you all to this unique program today. Today is the official opening ceremony of the Jackson FDO Hospital Eye Care Center, initiated by New Sight Eye Center, funded by Lions Club International Foundation, which seeks to increase quality eye care services in Nima County, Tapeta City. In today's gathering, we would like for you to keep kind and relax to enjoy this unique program. We say thank you to each one of you for being here with us today. We hope you enjoy your stay, and thank you, thank you, thank you.
I want to take this time to say good morning to you all. This morning, it is an honor to stand among a group of people who are not only eye health care providers, but also a group of men and women who exemplify the value of eye care in Liberia. Their generosity, dedicated services, and compassion have brought us to where we are today. A list of qualities we share could go on and on and on based on the services and the quality that we find in you. But I think the energy of New Sight Eye Center and the charisma is tangible as we see here today. As we celebrate this milestone in the history of Liberia, this will go a long way. And as we imagine, we did not imagine that we ever have eye care facility in this region. But today it has become a great achievement for all of us. Since we have reached the end of one role, it is only fitting we reflect on a humble beginning. How we started, who initiated this, who funded this, who would be the service provider, and who are the direct beneficiary to this program. The provision of eye health care is one of the most certifying professions in the world. And I'm always pleased to be part of the eye care history in the Republic of Liberia. I don't regret to be an eye nurse. As we reach this milestone, together with my staff and I, we will always sacrifice to make sure that eye care reach to the deprived community. Considering the overwhelming evidence that blindness is a significant socio-economic problem, it must claim both public and private sector attention. This is the only way we are going to significantly reduce poverty and reduce blindness in this world, in this part of Liberia. As we all know, the leading cause of blindness in Liberia is preventable and treatable eye problem. But with all a collaborative effort with stakeholders, with all a joint effort with stakeholders, we can achieve that. For New Sight Eye Center, this is our second initiative to the government of Liberia. First was in Grand Bassa County, where we have an ongoing eye care being provided. Second is the Jackson FDO Memorial Hospital. In 2020, honoring my ever leadership as the founder and executive director of New Sight Eye Center, along with my hard-working team, we developed a comprehensive proposal for the establishment of an enhanced secondary eye center in Tapeta City, Nima County. Said proposal was submitted through the Lions Club of Liberia, District number 403A2 for site first grant. Lions Club International Foundation, it was approved August 14, 2020 with a grant number of 2130 in an amount of over $400,000. With Professor Dr. Lion Harris currently serving as the grant administrator and Councillor Dixon Dole as the project chairperson. The project is fully funded, 100% funded by Lions Club International Foundation. A new site art center serving as the implementing partner for the next 3 years, commencing January 1, 2022 and ending December 31st, 2025, respectively. The project will officially be turned over to the Jackson F. Dole Memorial Regional Hospital Management Team for continuity after the 3 years. New site art center is expected to demonstrate best practice, transparency, technical support throughout the project, and this is to buttress the Ministry of Health effort towards achieving the universal access to eye health. The goal of the project is to provide routine access to quality eye health care services geared towards reduction of blindness and visual impairment in rural Liberia. We have the mission to effectively deliver comprehensive eye health care services that is equitable, accessible, available, and acceptable through a sustainable eye care model in rural Liberia. The vision is universal access to eye care for all citizens in Liberia. The type of services that we currently provide at this center, we screen, we diagnose, and treat different types of eye disorder. We perform eye operation, conduct medical and surgical eye outreaches, school eye health program, we correct refractive error, we provide advanced optical services, and we conduct eye health education. Strategic direction for this project will look at service delivery, human resource development, infrastructure enhancement, technology, and outreach program. What have we achieved to date? We renovated the facility, we equipped the center with modern equipment, we trained 3 eye nurses to become we trained 3 nurses to become ophthalmic nurses, 3 nurses to become optometry technician. We opened a project account. We started eye screening. We started doing refractive services. We started doing eye operation, dispensing glasses. What is our plan for the next 12 months? We want to continue the provision of routine eye screening and treatment. We want to train 1 cataract surgeon. We will continue the provision of eye operation at the center. Routine provision of optical services. Procurement of project logistics, that include vehicle and motorbike and supplies. Continue the provision of visual screening in rural community. And we also want to share both external and internal reports with our donor and our partners. The dedication of this eye center here today is a significant milestone for New Side Eye Center, and we consider this as a major achievement to the Ministry of Health. In so doing, I asked the Jackson F. Dole family to take ownership of this project. Ownership is the only way that we can add value to whatever we have. The only flower that I need if I leave this center is to make sure that the eye unit is well supported and is running as in line with Lions Club vision. Continuity of services is all that we need. I'm very grateful to the Lions Club of Liberia for working along with New Side Eye Center over the years to establish 2 site-first matching grants. Very, very grateful. Only God is going to reward you on this heaven. To also Lions Club International Foundation, who, in the shortest possible time, they are willing to listen to you when you submit our proposal to them. We are very grateful to them. Only God will reward them. Because with all your funding and with all your participation here today, you keep in your numbers. With all your participation here today, this program will not have been successful. So we appreciate your value and your services and your time that you gave to us. Also to New Side Art Center Volunteer Board of Directors who have been behind us all along. Our staff, New Side Art Center staff, we're up and down making sure that we provide this needed technical support. The National Eye Care Manager, Dr. Kekula, always giving us his advice. Our partners, both in and outside Liberia, and to our valuable patients we serve. We will always be grateful and we will always remember you. Keep on the candle burning. Thank you very much.
To the hard-working team of the hospital and to the new site Eye Center, and to all of our invitees here present. This vision is a long vision, and I'm happy that it's coming to reality. Robert had a dream, he had a vision that scared him, and I think it's gradually falling in place. Collaborating with the New Site Eye Center as an implementing partner, we also have the plan as a national eye health program to have hubs across the country, because you can't have secondary facility in all of the counties. We have 15 counties. So we group them and have referral hubs. And I think one of those hubs is in Grand Bassa County, also funded by the Lions Clubs International through the New Site Eye Center. And that is going to serve Riverset, Grand Bassa itself, and of course, Magui. So I want to say a big thank you to the team, and thank you for always being there, because I always see you in numbers. We were in Grand Bassa, and I saw you in numbers. So thank you very much, and thank you to the Chief Executive Officer. Thank you to all of you for making this a reality, especially to the New Site Eye Center. Thank you. God bless you.